What is a beacon? Well, a beacon can be something that you follow, something that leads people to safety or inspires people. One of the themes for one of the previous conferences was be a beacon. I think every single person in this room is a beacon, but there is one individual that stands out and is probably the brightest beacon there is right now in the free market movement. It's very influential. He touches hearts, he touches minds, and we're very proud to award this individual.
Yeah, and then I will add to that, because Jay just described the recipient. This is a fearless, totally fearless, completely disruptive member of the FMMA whose example we should all follow. Dr. Tony Dale. Thank you.
Sure. Wow.
Say something. Say something.
You better pull that hardware out, though, so everybody can see it.
Okay. I'm not often speechless. Yeah, wow, this looks wonderful. What do you say? Do I have time to tell a really short story?
Absolutely. Yeah.
I had just graduated from medical school. So this was the winter of 1975. And it was a winter of discontent in British hospitals and in the British hospital system. And for the first time in the history of the National Health Service, the doctors, the junior doctors, which was everybody who didn't yet have their postgraduate qualifications, were all technically on strike. Now, strike meant we did 80 hours a week as our basic work week. And after 80 hours a week, they began paying us overtime. What they did to pay us overtime was, instead of what they had done in the past, which was pay nothing, they had now begun paying us 1/3 time for overtime. Not time and a third, but 1/3. It was one of the busiest periods of my time in hospital while I was on strike. We were working probably 120 hours most week because we were also going through a flu epidemic, and it was a really bad one. And for the non-medical people, flu, a little bit like COVID, the majority of people are going to come through it fine. But for a lot of people, especially elderly with comorbidities, they get really ill. And they were dying like flies in our hospital. And on the particular night that this story begins, I was on duty doing the admitting through the emergency room. Everybody was coming onto our ward if it was a medical case as opposed to a surgical case. And a patient was admitted, just from my point of view, very routine. It was another elderly patient with, pretty bad case of some of the complications of influenza. And got him onto the ward and got him stabilized. And a few days later, maybe 3 or 4 days, I don't remember exactly how much, it was, getting near the time to consider sending him home because he seemed to have recovered. So I was doing a pre-discharge examination on him and wanted to listen to his chest better. He was, dressed and ready to go home. I couldn't, listen to him properly as he was sitting there on the bed, so I asked him to stand up, and as he stood up, he had a cardiac arrest. Of course, we called the crash team, and we were able to get him resuscitated. And for the next couple of weeks, he was very much in that place, sort of in between life and death, as he was being looked after in the emergency room. Not the emergency room, in the intensive care unit. Now, I'd got to know him a little bit in those 3 or 4 days before that particular incident happened. But now, after he came back from the intensive care unit, I was able to take much more time with him. And he was a fascinating gentleman. He made shoes and he made handbags. But he didn't just make any old shoes or handbags. He had made handbags for the Queen and in England. That's, kind of important. Now, he also had 4 kids. And I'm so glad I took the time to ask him about his kids. Because one of them, about 15 layers of bureaucracy removed, was head of our regional authority within the National Health Service. And so sort of 15 layers removed was his son was my ultimate boss, so to speak. And so, that was fascinating too. Anyway, we look after him, and, he's now well on the road to recovery, and it comes to the morning where he is going to be discharged, and the nurses call me in and ask me, they said that, Mr. Smith, that was his name, that he wanted a chance to say goodbye. So I came down to the ward, and as I arrived at his bedside, he pulled out of the little bedside table. We still had wards there, didn't have private rooms. Everybody was in a ward. There might be 20 patients in the ward. It was, when you think of health, it's a bizarre arrangement, but that's the way it functioned in those days. And he pulls out of his little bedside table a package, and he says to me, Dr. Dale, I know I'm not allowed to give you any sort of gift. Now, I'm human enough, I thought to myself immediately, why not? And he went on to say, but I've got something here for you that it's actually for your wife. And he was full of praise and appreciation for, the way we'd looked after him in hospital and all of this. And then he hands over this thing and he says, it's a handbag. And he said, it's identical to the one that I made for the Queen. Kind of moving for me, because these silly little incidents are the things that shape your life. And he gives me this handbag. If you ask Felicity sometime, she's still got it. It's a very precious sort of family possession. And I take the handbag and I'm walking away from the bed. And I don't know if any of the rest of you have ever had an experience sort of like this, but, being someone who takes my faith seriously, I'm, walking away, I'm sort of really feeling good, glad that, he felt that he had been so well treated, and, kind of feeling like, hey, I'm glad that, I sort of appear to be a somewhat competent doctor. And, as I'm thinking these thoughts, they were probably a little prouder than what I've just described to you there. I feel like I hear a little voice inside me, which I would identify as the voice of the Holy Spirit. And I don't know if in your theology God's allowed to be sarcastic, but this voice sounded really sarcastic to me. And what I heard was, Tony, Mr. Smith there, he thinks you're incredible. He said, actually, everybody here thinks you're incredible. But there's only one problem. Nobody knows why. And I found myself thinking about something that I'd been studying in the Bible. And there's a verse there in Isaiah 42, and I think it's verse 8. And it says, I am the Lord, that is my name. My glory I will share with no other. And I thought to myself, it's really important that people know who and what we are and why we are what we are. And God used that little incident to sort of challenge me that I would always give him the credit in any situation that I found myself in for, whatever it was that I was involved in doing. And over recent months, really it's been going on. If you wanted to speak to Jamie or others on the staff, particularly those senior members of the team at Sedera, they've heard me say over and over again, I'm praying that what happens through what we're trying to do in Sedera and what we're encouraging to happen right throughout the whole sort of free market medical ecosystem is so incredible that people will understand that actually they can't give us the credit. It could have only been God who did something like that. And that's really my hope and my prayer for this movement. I said to Keith just now when he handed me this, I can't believe it. Didn't sort of expect this. What do you do when you're honored? You don't want to denigrate the honor. I'm hugely blessed, and it's awesome. And thank you so much. I feel very unworthy. But there's something so much bigger than what we might feel that we're beginning to accomplish in this room. One of the key sort of economic things at the moment that is driving me, that has actually come out really clearly in some of the things that Keith and Jay have shared this morning, is we have the opportunity to help rescue this country from the edge of bankruptcy. If the average American's salary increase has not existed because of what's going on in the medical profession, or not just the medical profession per se, the medical ecosystem, and we have a way to change that, we can help rechart the course of where this country is going. And I think in the process, as we point people back just to what most of us would view as normal economics, that there has to be some sort of appropriate definition of value, because once you take away the value, Keith, you talk about this in some of the things you said, that when you realized that the government was just continually pushing your value down and down and down and basically saying an anesthetist isn't worth anything, that you decided that you were going to fire the system. You were going to fire what the government was doing, paying you. You weren't going to stop looking after the patients, but you looked after them for free, rather than allowing yourself to bill in a way that denigrated who and what you were. And I think as we look at these, we're looking at issues of life and death. Life and death for nations and societies. Societies like America, if you're a student of history, there have been many, many great, powerful, empire-building type societies. Britain, where I come from, was one of those. They used to talk about the fact that the sun never set on British soil, because everywhere around the world there was somewhere that Britain was, as it were, controlling. Okay, but the greatest of empires crumble when they lose the basic moral foundations on which they're based. And by moral foundations, I'm just talking about the nature of truth. If you want to understand truth, it comes in very simple ways. It's things like what the Bible says when it says we're to have honest weights and measures. I think it was Steve Forbes who talked about, be sort of careful about the moral underpinnings being lost. Because when we don't have honest weights and measures, when the government deliberately inflates our money or does all sorts of other things, what you do is you end up exchanging the truth for a lie. And if you know where that verse comes from, I think it's in Romans chapter 1. It says, and you end up then exchanging the Creator for gods made with our own hands. And it's in those contexts that all of our countries begin to go down a path into self-destruction, which seems to be so prevalent across American society today. And so I guess, that's more than enough for me, but I just want to say, I'm hugely honored by this. I don't deserve it. Any more than any of you. I'm an ordinary family doctor from England. I'm the least qualified person probably in here to speak. Okay, but into that, if we will stand up for what God puts in our hearts, God plus any one of us is a majority. And we can bring change to this land. So thank you so much for letting me be a part of what's going on. Really appreciate it.
Thank you.